Hey everyone, this episode of FMOL is longer than 5 minutes. The topic is simply complex enough that it warrants slowing down a bit to digest and understand the key points. I appreciate your understanding. Hello everybody, welcome to this edition of 5 Minutes or Less of EMS. I'm your host Kevin Mackey, coming to you again from Station 50, Sacramento Metropolitan Fire District. Today is part 2 in the topics of sepsis. Today we're going to talk about the how to use the sepsis protocol, what the key elements of the protocol are, and we're going to hear part 2 of Captain Cornell's story as well. So come along with us. Let's talk about sepsis. The sepsis policy for Sacramento is policy 8067. It has 3 key elements. It has definitions, it has policy, and it has protocol. We're going to talk about each of those separately, so let's start with some definitions. So really the 4 key definitions you'll have to know in sepsis are SIRS, or Systemic Inflammatory Response Syndrome, sepsis, severe sepsis, and septic shock. Let's start with SIRS. SIRS is really a generalized inflammatory response in the human body that has 2 of the 3 following elements. Either hyperthermia, defined as a temperature greater than 38 degrees Celsius, hypothermia, less than 36 degrees Celsius. The second component is an elevated respiratory rate higher than 20, and the third component is an elevated pulse higher than 90. The next definition is sepsis. Really, sepsis is SIRS with some known infection. That can be a urinary tract infection, it can be a skin infection, pneumonia, but there is a known infection. Severe sepsis is where we start to run into multi-organ failure, multi-organ dysfunction. Low blood pressures are especially prominent. Hypoxia can be part of it. And this is where we start to see lab abnormalities start to creep up, like elevated lactate. And septic shock is really a subclassification of severe sepsis. This is hypotension in the presence of sepsis despite aggressive fluid resuscitation. Okay, for the policy portion of 8067, you guys, we have to have 2 key parts. Your patient has to have 2 of 4 SIRS criteria. Those 4 SIRS criteria are listed right here: a temperature higher than 38 degrees Celsius, which is 100.4, or less than 36 degrees Celsius, which is 96.8. Or a respiratory rate higher than 20, or a heart rate higher than 90, or a blood pressure less than 90. So your patient has to have 2 of 4 of those criteria. And your patient also has to have either suspected infection by history, like a family member tells you that they're on antibiotics for pneumonia, or you have signs and symptoms consistent with infection, like cellulitis or skin infection, or you have a patient that has an altered level of consciousness for no explained reason, especially in the older population and the immunocompromised population, like cancer chemotherapy patients and patients with diabetes. So both of these have to be found in your patient to engage the protocol part of the sepsis policy, which I'm going to talk about next. Okay, let's wrap this up, guys, with a discussion about the protocol side of things. So for the sepsis protocol, 2 sections, BLS and ALS. BLS is about oxygen administration to maintain SATs above 94, pre-alert notification, and rapid transport. The ALS section, fluids, large bore IV, 500 cc fluid boluses to achieve a blood pressure above 90 systolic. You can give up to 4 boluses or 2,000 cc's. Also, don't forget about pre-alert notification is key to the hospital as well to get them ready. And then if you get to those 4 fluid boluses and your pressure is still under 90, you can move to a pressor. You can use dopamine, or you can use push dose pressors if dopamine's not available. So thanks for joining me. Don't forget about the 4 key sections of the policy. 3 key sections of the policy: definitions, policy, and protocol. In Sepsis Part 1, Captain Cornell tells the story of her 18-year-old daughter who developed severe sepsis. Her daughter's pulse is 150, her blood pressure is 80 systolic with no response to aggressive IV boluses. Let's pick up with Part 2 of Captain Cornell's story.
And it had been 3 days and her blood pressure was still very low, and they were throwing all kinds of antibiotics at her. And it wasn't until an infectious control doctor came in and she said, you know, I think this is Lemire syndrome. Hers went into her lungs, and they finally found the right antibiotic to throw at it. And then 6 days after that, she got bilateral chest tubes because they couldn't get the fluid out of her lungs. Gosh, I just remember sitting there pulling the fluid from her lungs with a syringe as she's bent over, and I mean, I thought she was going to die. And I actually called my mom and dad and said, you know, you guys need to come out here because I don't know that Heather's going to make it. And so sepsis is not an old person's disease. It can affect anybody. And the good news is, after 21 days, my daughter came out of the ER, or out of the hospital, and she was put on a PICC line and given antibiotics for another 3 weeks. So she walked around with her little bag of antibiotics, and she just passed the CPAT test and is trying to get on a fire department.
Has this changed your approach to patients that you treat as a paramedic?
Oh, absolutely. I don't take anything for granted anymore. I don't take an age for granted. I don't take their complaints for granted. I absolutely take it serious and look at each complaint with an open mind. And I am really glad that we have gone the route of treating for sepsis and looking for the signs and symptoms a lot more aggressively than we used to.
Very good. Well, Shani, thanks for telling your story. I really appreciate it.
Absolutely. Thank you very much. Thanks for having me. Dear and near to my heart. I'm glad we're getting the information out there.
Absolutely. Thank you. Okay, everybody, that's a wrap. This has been a good discussion on sepsis. We did 2 parts, the why and the how of sepsis. When pre-hospital providers get involved in the mix of sepsis, there's early identification, early notification, early patient care. All works together to improve patient outcomes. Special thank you to Captain Cornell for sharing her personal story. I invite you to come along next time and join us on the next edition of 5 Minutes or Less of EMS, and don't forget to subscribe to the channel. Have a great day.